IEP Urgent Care and Henry Ford Jackson Hospital Emergency Physician, Dr. Jacob Sinkoff. Welcome to the show.
Good morning, guys. Thanks for having me again.
Good morning.
Oh, yeah. Guess what?
We've got some news for you.
Oh, goodness.
We have some news for you. Dr. Jacob Sinkoff, you are the morning show's 2,000th guest.
Oh, wow. I'm honored.
2,000. Congratulations.
Oh, thank you.
Thank you. It'll be a lovely parting gift on your way out.
Awesome.
Oh.
Thank you.
Oh,
Not even on his way out.
Oh,
Here we
wow.
have for you
$2,000.
$2,000.
Oh, my goodness.
$2,000.
Well, thank you so much. I was going to say congratulations to you guys.
Yeah, thank you.
2,000.
Ugh, goodness gracious.
That's a lot.
You really gave him $2,000?
Everyone's going to be so jealous of me now. Gosh, I hope this is a good segment. Should have done this at the end. Now I'm nervous.
It's already a good segment.
It already is,
Good.
for sure.
Perfect.
So I'm thinking this back to school stuff, and as a parent, it's like, I still haven't even done the physical.
Yep.
You know, I mean-
Yep. So yeah, one thing I wanted to kind of touch base with today is back to school physicals, sports physicals, just easy to get done. Make an appointment through the urgent care. Just go online, you get a time slot, and you can get your physicals done. If you know, like everyone else, it's kind of a last minute thing. You guys are trying to squeeze every ounce of juice out of your summer, and it's like, you got to get that physical. So
Yeah, I think with you think with like middle school and high school too, if you're playing a sport for the first time, usually the practices have already started or they start day one. So it's really something you need to do ahead of time.
Yep, absolutely, and the practices. People forget those practices start early on, very early before the school year starts. Very warm outside, staying well hydrated, getting your physicals done, everything like that. Very, very important. So.
It's going to get a lot hotter this week, and early
Yeah.
next week will be in the low 90s. So
Yeah. So staying well hydrated. I don't know if they still do 2-a-day practices in football.
No one says if they do
a little
or not.
frowned upon nowadays, but just making sure you stay really well hydrated is important with those football and soccer practice, right?
Yeah.
Soccer in the fall in Michigan. So. Staying well hydrated.
Yeah, water used to be frowned upon during football practices.
It's amazing
that
how
funny?
Whether it's medicine or just just how things evolve, which is good.
Yeah.
Once we learn more information and remember salt tabs and
Right.
not having
Oh my gosh.
water.
Like water. You need water? Toughen up. We'll get you water when we're done.
we had, in my high school, our football team had this giant thing of these horse pills that were salt tablets, and we were forced to swallow them like all day long.
Yeah,
It's like,
it's no water and just the
Jeez.
salt. And obviously, some of the electrolyte replacement's good.
Yeah.
I don't think those big salt tabs were great, but water or something with a little bit of electrolytes like Gatorade or Pedialyte is very important. And you can't, drinking it, staying well hydrated.
Where can we get those salt tabs? I'd like to place those out at my house for folks.
I think they were banned by the
Yeah, they actually still, some people need them medically, so they still, I think, you might have to get a prescription to get them now, but they still have them. So,
as kids are getting older and getting into, say, middle school and high school sports, parents are going to maybe see some injuries that they haven't seen before, a broken bone, a severe sprain. If you have a broken bone, or you think you have a broken bone, let's say, I don't know, you get in the car after practice, what should you do? Should you just come right to IEP?
Yep, so if the bone's pointing in a different direction than what you think it should, probably the emergency department's probably your best bet. But if it's swollen, even if it's broken, the urgent care is very capable to handle those type of injuries. They have x-ray on site. Main thing until getting there, Tylenol, Motrin, keeping it elevated and icing it, especially in the acute phase of the injury, keeping that swelling down is very important and helps a lot with pain control too.
Yeah,
so
it's nice to be prepared so you don't have to panic when something does happen.
Yeah.
You can just
and with it's to be expected with with sports is there'll be sprains and strains and everything like that. So
You just don't see broken bones much anymore. I just last week saw a kid walking with a cast in a sling on his arm, and I thought, wow, you just don't. I mean, you used to see people walking.
Well, that's because kids used to play on jungle gyms and fall, and they don't do that anymore.
yeah,
They're safer.
yeah, yep. So
Dr. Katayan was here the other day, and he said he's concerned that people are using the ER as their doctor office when they're not really having an emergency. Is that happening?
So to an extent, so we pride ourselves on, we'll take care of, any person at any time for any reason. That being said is, we're busy. So, and obviously we focus our patient care on who the patients that are sick are the sickest. So, in terms of, following up with the urgent care, if you have a cold, is probably, we'll get patients in faster, we'll deplete less resources and everything like that. But a lot of people aren't able to tell kind of, hey, is this indigestion or is this a heart attack? And, for those people, that's why, the emergency department's there. But yeah, I think a lot of it's just knowing, hey, the urgent care is there, and a lot of times you get in and out much quicker than going to the emergency department. But we'll always be every emergency department in the country kind of a backstop for patients that don't have insurance. We see everyone for any reason. We never turn people away, obviously, and it's something we pride ourselves on. But yeah, a lot of times, for some of these minor things, following up, Henry Ford has a lot of same-day clinics that people are unaware of. The Center for Family Health has a walk-in clinic. Obviously, we have our urgent care. So a lot of different resources patients can use, but like I said, if we're always open 24/7, 365 days a year. So.
With Dr. Google, do people come in and tell you what's wrong with them?
Absolutely. Yeah. Sometimes they're right, not always, but sometimes. And what I think is important is addressing patients' concerns.
Right.
So if someone comes in, they're like, and it's very helpful if patients are open about it right at the beginning. They're like, yeah, I'm worried about this, and then you can address it right off the bat. A lot of times you'll see a patient, and that's why usually I say, right when I see them, it's like, is there anything else you're worried about or any other questions? Because or else you get everything done. Like, oh, everything looks good. Then right as you're walking out, they're like, well, what about?
I forgot to tell you
about this thing that I was worried about. So addressing it, but absolutely, and of course, I don't know if it's a legal issue, but whenever you go on Dr. Google or whatever, obviously, no matter what your symptom is, you're worried about cancer and stuff like that, and those are valid concerns. So bringing them up and getting them addressed are important too. But it's kind of funny, some of those algorithms, you type in all your symptoms and it spits out all these
runny
all
nose,
these things.
Cancer. Well, quit looking it up.
Allergies, So it could be a little bit of anything. So.
I think the drug commercials are making people sick.
The drug commercials are making me not want to take the drugs. I'll tell you that.
The list of the side effects.
I mean, it's almost absurd.
Is crazy.
Yeah.
So, I mean, and there's and they have to legally, I think, put every little side effect that someone complains. But if you have someone a placebo, they'll have a side. You take a placebo and then you get a cold the next day. Well, they have to list that. Stuffiness and whatever. And it's crazy the amount of side effects on some of these.
How about this Zempa that's kind of taken the world by storm here?
Yeah. So some of the side effects, of course, to that medication are nausea, vomiting. We've actually seen some people in the emergency department with really bad nausea, vomiting, diarrhea, some of the GI side effects from that medication. They just take it for weight loss.
Right.
So there's been a lot of shortages. Because people are using it for kind of the weight loss, cosmetic type.
Talked to Dr. Austin Brown yesterday, and he has, so many people are coming in to the pharmacy requesting this because it is a crazy weight loss result, but it is a diabetic medicine, correct?
Yep, correct. Yep. So it's used to treat diabetes. Unfortunately, I think there's been so much shortages that some of the diabetics aren't able to get the medication because but it works for that. But like any other medicine, for this one, there's side effects too. So, so just be careful, and sometimes it's harder to get now. So if you're lucky enough to get it, but it does work for weight loss.
Yeah, it's amazing seeing some of the results. It's crazy.
Yeah. So anyway, they kind of kind of not work out and not eat healthy.
Yeah, there's
so,
a magic pillow.
Yeah, or shot or.
I think Ozempic is it's reformulated from Olestra. Remember Olestra? It caused diarrhea and vomiting too.
What's amazing, some of these medications, because that's how Viagra was originally discovered.
Really?
It was not a male performance enhancer medications for pulmonary hypertension. Then they noticed this side effect.
That's crazy.
What a side effect! And then all of a sudden that
side
really
eff-
stumbled on the gold mine.
The side
there.
effect becomes the main drug.
Exactly.
Yeah.
So the same thing we're kind of seeing with Ozempic. Now
Amazing.
they found this thing that they weren't, this weight loss. They're like, well, maybe we should give this to her. And those drug companies, they really hit the jackpot again. So
We appreciate you being here today as our 2000th guest.
Yes.
And all your other times you've been here too.
well, thanks again to 2,000 more.
Let's do it.
From Henry Ford Jackson Hospital and IEP Urgent Care, Dr. Jacob Sinkoff. More in the morning.